With renal artery stenosis, stenosis means narrowing, which refers to a progressive narrowing of the renal artery, which is the artery that carries blood to the kidney. This means that the blood downstream of the narrowed spot that goes to the kidney is at lower pressure, which gets sensed by the kidney. Since an important role of the kidney is to sense and help maintain a normal blood pressure, the kidney then tries to raise blood pressure throughout the body. Inside the kidney, there are millions of nephrons, each of which help to filter the blood and then fine-tune the composition of blood by carefully reabsorbing and secreting electrolytes as fluid passes through various parts of the nephron. Blood approaches the nephron via the afferent arteriole. You can remember it as A for approach, and then forms a tangle of capillaries called the glomerulus before exiting via the efferent arteriole, E for exit. That efferent arteriole goes on to split into another set of capillaries, the vasa recta, which surrounds the nephron, and then blood leaves via the venule. So there are two capillary beds per nephron. Usually we think of it going arterial, capillary, venule, but in the nephron it goes arterial, capillary, and finally venule. So nephrons have the general shape of the letter U, with the beginning and end portions getting pretty close to each other. The reason that this matters is that over here, lining the inside of the afferent arteriole are endothelial cells. Wrapped around them are juxtaglomerular cells, which are super special smooth muscle cells that contract down like normal smooth muscle cells. But they also have the ability to release a hormone called renin in response to low blood pressure. Over here, close to the distal convoluted tubule, there's another special group of cells that line the tubule called macula densa cells, which are sodium chloride sensing cells that detect the sodium concentration in the tubule. These two clusters of special cells work together, because if the blood pressure falls, less blood's filtered and less sodium gets into the tubule. This is then detected by the macula densa cells, and they send out a local prostaglandin signal that reaches the juxtaglomerular cells and causes them to release renin. In addition, the juxtaglomerular cells are able to directly sense low pressure in the afferent arteriole, and also respond to sympathetic nerve fibers to release renin. Now, renin helps to constrict blood vessels and increases sodium reabsorption in the nephrons, which ultimately causes blood pressure to rise. Normally, as the blood pressure rises, the juxtaglomerular cells are no longer triggered to release renin, so balance gets restored. One cause of renal artery stenosis is atherosclerotic plaque buildup, which is where a mix of fat, calcium, and immune cells form a crusty rim on the inside of the artery. Another cause, though, is renal fibromuscular dysplasia, where fibro refers to fibrous collagen connective tissue, muscular refers to smooth muscle in the artery wall, and dysplasia means abnormal development. So renal fibromuscular dysplasia is when something goes wrong with connective tissue and smooth muscles in the walls of the renal artery, resulting in a series of bulges and narrow spots that leaves the artery looking like a string of beads, instead of a uniform cylinder. Fibromuscular dysplasia classically develops in young women, but the exact underlying cause is still unclear. In both atherosclerosis and renal fibromuscular dysplasia, the renal artery narrows, and that causes the blood pressure to stay low in the kidney, as well as all the kidney's nephrons. As a result, the juxtaglomerular cells release renin, which might raise the blood pressure in the body and vessels before the stenosis, but the pressure in the kidney and the afferent arterioles stays low, so they just keep releasing renin. So renal artery stenosis creates a vicious cycle of high blood pressure, or hypertension, which puts incredible stress on the blood vessels and can contribute to having a stroke or a heart attack. Also, since the affected kidney receives less blood than usual, it eventually starts to atrophy or shrink in size, as the kidney cells die off and get replaced by fibrotic scar tissue. If the renal artery stenosis involves only one of the kidneys, then the other kidney can often pick up the slack. But if both kidneys are affected, then it can lead to acute kidney injury or acute renal failure. Symptoms are often a result of the hypertension, which if it gets severe can cause things like headaches and blurry vision. The diagnosis is therefore based on seeing if there's an underlying cause for hypertension. Physical exam might reveal a brute, which is a whooshing sound heard with a stethoscope over the renal arteries in the abdomen, caused by the turbulence of blood flowing through the stenotic part of the renal artery. Basic screening labs like serum creatinine and a urinalysis can help assess kidney function as well. And imaging studies like ultrasound, CT scan, and MRI can visualize the kidney. For example, in this CT scan of the abdomen, the atrophied kidney is a lot smaller than the healthy one on the other side. Ultimately, since the problem's in the renal artery, a renal arteriography can be done to visualize the renal artery with dye, to see if there's evidence of a blockage. Generally, atherosclerosis forms in the beginning portion of the renal artery, where it branches from the aorta, whereas fibromuscular dysplasia develops in the middle to far end of the renal artery, nearest to the kidney. Treatment of renal artery stenosis is aimed largely at trying to manage hypertension, through using medications as well as adopting healthy eating and exercising habits. In addition, a surgical procedure called a balloon angioplasty can sometimes be used, and this is where a balloon's used to open up the narrowed portions of the renal artery, and in rare cases, a tiny stent is left behind to keep the artery propped open. An alternative option is to simply bypass the stenosis with another artery that's grafted into place. Ultimately, if one kidney becomes atrophied and non-functional, it also might be necessary to remove it. Alright, as a quick recap, renal artery stenosis is where the artery that carries blood to the kidney becomes narrowed, which reduces the amount of blood that the kidney receives as well as the blood pressure. The kidney senses that low blood pressure and responds by releasing the hormone renin, which increases blood pressure, ultimately causing hypertension. Over time, the lack of blood flow can also cause the affected kidney to atrophy. Hey guys, thanks for watching. Hope you liked that video. Special thanks goes to Charles B. Davis for writing the script, as well as Kyle, Rishi, and Andrea for editing the script, and then I put together the illustrations. It's pretty much all I got for you, besides to remind you to check out our new subreddit, which is called r/osmosit. It is really new, so it needs some love. So check that out if you have time. Otherwise, you can always support us by following us on social media, as well as donating on Patreon and subscribing to our channel. All right, guys.